Jim, thanks for doing a video testimonial for us. You've come to the conclusion of a 6-month program, and you've overcome quite a few challenges, health issues. And why don't we just back up and talk about what you came in with? What were your presenting complaints that were most problematic to you?
Well, the biggest one was IBS. That was just such an annoyance that I had battled for at least 3 years. Also had a lot of back issues and GERD, or just heartburn that was just really bad, where the doctors had me on omeprazole once a day, 40 milligrams for the last, I don't know, 3 or 4 years now.
Yeah, and you had, because the GERD had been so bad, you had the esophagus ballooned.
Yes.
How many times?
Just once, but been tested like 2-3 different times over the years.
Okay. And so we did some things to determine what was contributing to that condition. One of those was a food antigen panel. And as we took out some of those foods, did you see an impact?
Big impact. I went gluten-free, and that made tremendous impact on especially the esophagus area and just the pain that I was having there. Also with the IBS, it just it turned my life around completely.
Okay. So that's one of the things that we took out. Probably didn't need the food antigen panel for that. Were there quite a few others that were on your panel that we had to pull out?
Yeah.
Name 3 of the more significant ones that were unique to you. You might have thought were healthy foods.
Yeah, well, oats. I mean, I love oatmeal. I mean, that was my go-to every morning. That
Yeah.
was one big one.
Any vegetables or fruits that were a problem?
No, well, lettuce. Iceberg lettuce was a big problem, which is another biggie for me. I thought eating lettuce was a good thing, so I ate a ton of that.
Yeah, and yet it showed inflammatory on your test.
Yes, exactly. Yeah.
Any others?
Those are the main ones. But like I said, the gluten was a big deal. That was my biggest hurdle and the biggest one that was causing the inflammation.
And that one showed up positive for you on the test.
Yes.
We ran some blood panels and got some direction that way. Did you see the value in having before and after testing to lead what we were doing?
Oh, absolutely. I mean, I didn't think I was that bad till I saw the blood panels, but then just seeing over the period of the 6 months and the retesting, and it's encouraging because you see the positive results, and so quickly, really. I mean, think about 6 months is not that long, compared to a lifetime of what you spent, getting to that place where you're not good.
Right, right. And then we did some work on your back, taught you some exercises and stretches, and did some decompression and some spinal work. You had what you described. Well, why don't you describe what you had when you came in?
Well, I have scoliosis anyway. It's probably born with it, but my lower back was really just always in pain. I had gotten spasms. I had a bulging disc and having spasm every time I laid down to go to sleep. Just constant pain. And so coming here, and Dr. Hoyt, by the way, is a great chiropractor. He, like you said, gave me some exercises, some stretches, and did the decompression, and now I'm 100%. I feel 100% better. I mean, more than 100%. I've never felt this good in my back area for years. It's
Awesome.
been a lifetime of construction work, but now it just seems like I'm a new person.
Super good to hear. And the IBS?
IBS is gone. I mean, it's just, I feel 100%, 110% better. I just didn't realize how distracting and how painful it was until, it started going away, and started appreciating, I don't know, it just seemed like a better outlook on life because, that pain is gone. And
Well, it certainly takes the burden off, doesn't it? Frees your mind up to think about other things.
Yes, because it was such a distraction.
Well, you were very committed. I'm sure you would agree it's not the easiest thing you've ever done, but hopefully the results were, like you said, very well worth it.
Yeah, very, very well worth it. And I just want to say that I'm just thankful to Dr. Hoyt. He's just an amazing guy, very patient, and I appreciate his staff here too. And they do an amazing job. They're just always here to serve us and always answering our questions. So I just want to say thank you guys.
Appreciate your kind words. Great work on this. Congratulations.
Thank you.
Bye.